Welcome back. We thought we'd change things up a little bit for you and give you an intermission. Just kidding. We had some technical difficulties and Henry has worked through it. Henry, you want to tell us what happened?
Yes, so as the streaming was just going, the bit rate just dropped down to 0. I was trying to see what the main problem was, and I did everything I could to just bring it back up by restarting.
But do we know why the bit rate dropped to 0?
I'm still trying to find that answer, but I'm doing everything I can to just keep this maintained.
I would make note of the time that it happened. I would let Jose know and have him see if we had a internet service performance drop off. That's why the bit rate dropped. I don't know.
Copy that. No,
I don't know.
I'll keep. I'll notify him.
Is that a piece of our equipment issue, or is that an internet service provider issue?
My assumption would be the internet service, but I'll contact Jose and find the answer.
Thanks. Just make note of the time.
Copy that. Thank you.
So he can check the records. All right. Welcome back. Sorry about the drop off, but it's out of our control. And we're back. So we're still working on the L1-2 disk, right? Are we at L1-2 or L2-3? This is 1-2. So we're at the left side doing L1-2. I'm just cleaning up the herniation, cleaning up the tear, actually, the annular tear. And that blue stuff is the herniation in the tear, called the interposed herniation. If you have questions, I'll be happy to take them. This is a pretty degenerated disc. So this treatment works for degenerative disc disease very nicely. And I get the question at times, Dr. Duke, can you get an MRI afterwards? The answer is yes, of course, but there's really no reason, because your disc is never going to look normal. You guys that have watched enough of these surgeries with me, you know, if you look down here, right here, we're almost done. That's not a normal disc. It's never going to look normal. We're not trying to do surgery to make discs look normal. We're trying to do surgery to get rid of your back pain, get rid of your leg weakness, your leg pain, your leg numbness, your leg tingling. So we want to get rid of your radiculopathy. We want to get rid of your neurogenic claudication. We want to get rid of your weakness, numbness, tingling that's only going to get worse. We want to get rid of your back pain. That's really our goal. We're not here to make your disc look like, the Miss America of discs, or the Miss Universe of discs. This is not a fashion show. This is not a prettiest disc after surgery show. This is a get rid of those symptoms that are hurting you and keeping you from living a full life. All right, we're pretty much done here. So we don't get MRIs after unless there's a problem. If we think somebody reherniated, for example, we'll get an MRI, but that's very rare. What is a reherniation? A reherniation is basically where somebody gets their herniation removed and then they pop out another piece of herniation. Does it happen? Yes. It happens in virtually all spine surgeries. Less common in fusions, but it still happens. And in the Duke laser disc repair, it happens. We get it 1% of the time. That's 1 in 100 patients will have a reherniation that needs treatment. Okay? Some reherniations actually don't need treatment because they just don't cause symptoms. We would only treat a symptomatic reherniation, one that causes symptoms that don't go away. All right, done with the left side. I'm going to show you. Can you get a picture of this here, Henry?
Yes, we can.
You see how tiny the incision is? It's about 7 millimeters. So we're coming out with our tube and apply a little bit of pressure. in case there's some bleeding. You can see little pieces of disc herniation just laying around back here because they float out during the surgery. We literally, with the laser, I'm blasting all those pieces, those herniations into pieces, right? Breaking it up into little pieces so they can float out. And that's what you're seeing laying around outside the tube on the patient's back are little pieces of herniation. All right. Moving on to the other side, we'll start with 3-4. There's the guide wire. We're not the first to use a guide wire. Guide wires have been used in spine surgery for many years. We started using guide wires back in the 90s to do spine surgery. They were being used at that time for pedicle screw placement. So people talk about percutaneous pedicle screws, which means putting a pedicle screw in through the skin, and that's done without, doing an open incision, big open incision. So where I trained at UF in Gainesville, we were one of the first in the world to put in percutaneous pedicle screws. And again, that's because our university training program in neurosurgery was so ahead of the rest of the world that when you have really good faculty teaching, they're going to use the newer technologies, and that's what we did. So we were doing percutaneous pedicle screws using guide wires before anybody else was. I was with Dr. Rick Fessler and the one whose name we shall not speak. Is that it?
Yes, sir.
I get a lot of comments about the hammer. Listen, did Thor have a hammer? Did he use it for good? Let's not complain. All right? Just think about this as being Thor's hammer, except it's Dr. Duke's hammer. All right? There you go. So hammers are not always bad. They can be good. So I don't want to hear any criticism about my hammer.
We have a question.
Sure.
This comes from Billy54. He has 2 questions on YouTube.
Of course. Happy to answer them. Nice of you to join us, Billy. 54.
Billy asked, how long after surgery can a patient return to regular activity like golf?
Hey, that's a great question. This patient here is a golfer. Actually, a lot of my patients are golfers, to be honest. They're smart. They don't want a fusion. So the answer is, it really depends on your individual case. But I could say with 90% certainty that you can return to putting in 2 weeks. Putting in 2 weeks after your surgery. And then you can play your intermediate game, your fairways, come on, in 6 weeks after surgery. And you can start driving the ball at 3 months, 3 to 6 months. So you can go back to your full golf game 3 months to 6 months after the surgery, just depending on how many discs, how bad the discs are, how much work I need to do, how fast you heal. But 6 months latest, 3 months earliest after the surgery. And the nice thing is it's all natural. There's no fusion being done. So we're not putting metal in your back. You're not getting a stiff back. You're not getting metal in your spine like an artificial disc. Those things pop out. And then you have to have an emergency surgery, life-threatening surgery situation. We don't have any of that with this surgery. This is a natural repair. You don't see us putting screws and rods in people. You don't see us putting a metal disc in anybody. We're not removing any of the normal bones or ligaments from your spine. This surgery is the most perfect surgery in 2023 that you can get. Why? Because the only damage we're doing to the body is we're making a cut on your skin. And the rest of it is done with a technique where tissues are spread open, okay? Spread open. And spreading things open using that dilator, you're basically pushing the fibers apart. Like you're like opening a door, going through, and then when you come back out, you close the door and everything's fine. You haven't damaged anything. But when it comes to open back surgery, whether it's an artificial disc, a laminectomy, a discectomy, the mild procedure, interspinous devices, intervertebral devices, facet devices, I mean, you name it, all those treatments require damage to your muscles, your ligaments, your tendons, your bones, because they're doing laminectomies. They're doing removal of ligaments and tendons in your body. We're not doing any of that because we're coming from the side. This technique of coming from the side of the spine, in the lumbar spine, it was developed by Dr. Parvis Camben from Pittsburgh, okay? He was an orthopedic surgeon. Look at this tear, by the way. Man, that is ugly. It looks like a monster trying to get us. But all this little strandy stuff are fibers of the annulus that have been ripped apart. And the blue stuff is the nucleus pulposus, which is supposed to stay in the middle of your disc. It's pushing out through the fibers and getting stuck in there. And the reason it's stuck so down so much is scar tissue from inflammation. Inflammation creates scar tissue. Okay? That's how you get scar tissue. It's from inflammation. Inflammation is one of the stages of healing. Whenever you have an injury to your body, your inflammatory system comes and it basically brings cells that release chemicals that break down proteins and fats and carbohydrates, and it breaks everything down into little building parts. Kind of like a demolition team taking down a building. It breaks the building into its concrete, steel, and all the other components, you know? And basically that's what your inflammatory system does. It attacks. It attacks the area, breaks it down, and then scar tissue comes in to rebuild. So this, what you're seeing here, because there's scar tissue and there's inflammation at the same time, you're actually seeing both processes, both stages of healing occurring at the same time. They're not supposed to occur at the same time. You're supposed to have inflammation for a week, and then it goes away, and then the healing comes in with the scar tissue. But what's happened is, because the herniations keep happening over and over again, 5, 10, 15, 20, 30, 40 times in your lifetime, over 20, 30 years, you're getting the inflammation phase, and then it's dying off, and then your repair phase comes in with the scar tissue, and then you re-injure the disc again because the tear is still there, and it never healed properly because you got the nuclear material still stuck in there, keeping it from healing, and then you get another phase of inflammation. So it's a cycle of inflammation, scarring, inflammation, scarring, inflammation, scarring. And this is the result right here, what you're seeing. That's what the Duke laser disc repair fixes. You see the annulus tear and the nuclear material right here, stuck. So I'm literally debriding the annular tear, and this is the only surgery in the world that does. We pioneered it at Duke Spine Institute. We were the first ones to discover it and do it. Yes, it's endoscopic spine surgery. It's a type of endoscopic spine surgery. And there's literally hundreds and hundreds of types of endoscopic spine surgery in the spine. Okay, so many different types. The very popular one in Asia right now is UBE, unilateral biportal endoscopic. And that's not what I do. I do something I think more advanced. UBE is for people who are less skilled. I'm sorry to say it, it's a different technique, but I got no other way to say it. But that's the God's honest truth. When you can't put all your instruments in one tube, you use 2 tubes. Okay, so that's what the UBE technique is. We do everything in 1 tube. It's a much better way. A biportal requires doing a laminectomy, removing ligaments. It's not a very good surgery. It's not transforaminal. It's translaminar. Okay? Anyway, questions? Keep an eye on that other one. Any questions? Look at this. Very different than the last disc that we just did. The last disc was degenerated. This is not quite as degenerated. Lots of this fluffy, swollen annulus.
Yes, we have a question. This comes from Billy54 once more on YouTube.
All right.
And they asked, my MRI shows a degenerate disc at L5 to S1, and I am worried about fusion as my only option. Generally speaking, will your technique work for that? Thank you very much for your great work and videos.
Hey, Billy. So, Billy, the answer is yes. This surgery right here would fix your problem. You don't need a fusion. There is absolutely nothing a fusion can do better than this surgery. Getting rid of back pain. This surgery works better than a fusion. We get rid of 100% of the pain coming from that disc. Recovery. This surgery recovery 1 hour. Fusion, your recovery is going to be at least 3 months. Okay? Duke laser disc repair, return to work. You can go back to work tomorrow with this surgery, the next day. With fusion, you're going to be out of work for 6 weeks to 3 months, 6 months. Just depends on how the fusion's done and what kind of work you do. So, risk of complications. Fusions at L5-S1 have a risk of complications of around 10%. That's 1 out of every 10. That's an average number for all surgeons. Okay? Some surgeons it's higher. It's 25, 50% complications. That's a 50% chance you're going to have a complication with a 50% complication rate. With the laser surgery, we have had 0 surgery complications. We've never had a nerve damage or nerve cut. We've never had a spinal fluid leak. We've never had a patient paralyzed from this surgery. We've never had infection from this surgery. We don't have adjacent segment disease. With fusion, you get adjacent segment disease. That means the next disc above or below is going to go bad. In your case, above. Okay? Then you have complications from the hardware with fusions. Like the screws get loose, or they break. The body doesn't fuse properly. It rejects the screws. You don't have that with the surgery because we're not putting any screws. This is a much better surgery. I have done 1,000 fusions in my career of the lumbar spine. I've even published papers on it. Go look in PubMed, type in PubMed, which is the National Library of Medicine in the United States, and type up Duke Majan. Duke Majan, and you'll see publications. And one of them, there's several on fusions, but one of them is combined transforaminal lumbar interbody fusion and posterolateral fusion, segmental instrumentation, whatever. That is the best fusion that could be done at L5-S1. And that's what I've published on. Okay? And you can see that we had 85% elimination of back pain in that paper. So 85% of people's back pain gone. With this surgery you're watching right here, we had 95% at 6 years follow-up. And that's been peer-reviewed and published. So the outcomes of the Duke laser disc repair are far better than fusion surgery. You don't want a fusion. You don't need a fusion. If you're having a fusion, maybe it's for the wrong reasons. Maybe it's because, I don't know, maybe you don't realize there's a better option out there. But that's why we do these broadcasts. We do these broadcasts so people can see there's a better option for them than what their surgeon is telling them. Fusions are dangerous. We're trying to get people away from them. Unfortunately, that's what their doctors recommend because that's all their doctors know how to do. And their doctors make a lot of money doing fusion, so they don't want the patient doing anything else. Huh? Is everything okay, guys? I got 30 seconds, maybe 1 minute left on this disc, and then we got one more to go. You can see how much herniation there is stuck inside the annular tear. This whole time we've been doing an annular debridement. The whole time. On this disc, annular debridement. Effusion doesn't do an annular debridement. And so you're still going to have pain after your fusion because they don't do annular debridement. Look at all that herniation, the blue stuff popping up. Just about done. Great questions today. How's our live stream? Still going?
Still going so far. Everything's so good. So far, so good.
All right, so I'm just about done with this disc. I've got one more to go and then we'll be done. So this patient had 4 herniated discs. All 4 of them were pinching nerves, causing weakness in his legs, numbness in his legs. And now with this surgery, the nerves will be unpinched permanently. He can actually have his nerves heal and recover. Now I will tell you another thing about this patient, and it's very common. He actually also had piriformis syndrome. Look it up, Piriformis syndrome. Piriformis is basically an overstretched muscle in your buttock. It's a torn muscle. We call it a muscle strain or sprain. And we treated that with a piriformis injection yesterday before he came to surgery today. He's already feeling better. The point I'm trying to make, though, is that when you have pinched nerves in your back and you get weakness in your legs from it, then you start to walk bad and stand bad, and it changes your gait, your station. And what that does then is it causes your other joints and muscles to be strained. And when they're strained, they don't work properly and they get overused. So, you know, one of the things that people have to do after this kind of surgery is therapy. The therapy I always recommend is gait training. Basically, it's walking, relearning the walk. And to help them relearn the walk, I have them swing their arms. So they have to walk on a flat surface, and I have the patient swing their arms. Swinging your arms keeps you better balanced, and it makes you walk straighter and use the proper muscles. It's the best self-therapy there is. So I've gotten away from, you know, sending patients to physical therapists after the surgeries, because a lot of times the physical therapist will do the wrong exercises for the patient, and the patient will just have problems from the therapy. And so ever since I switched to self-therapy, I haven't had those issues. And people generally just get back in shape themselves. All right, 10 seconds. You can see the epidural fat. Just about done. Still little pieces of herniation I'm taking out right there. Any questions?
No current question.
Excellent. All right. Great job, everybody. Let me get this last disc done and we'll be done. All right, let's see what we got here. The nerve is going to be right there in that fat. I'm just going to get this little bit of herniation. This is just underneath the nerve. It's not really pressing, but that's a piece of herniation right there. So, all right, we're all done.
Lights on, please. Thank you.
You can see the vein right there. Look at the vein. It's kind of neat. You can see some scar tissue on the surface. You guys see the milky white stuff on the vein? That's scar tissue from chronic inflammation. Actually, let me get the laser one more time. There's a little corner right there I want to get. I just want to make sure that's nothing significant. People ask me, do you get all the herniation when you go in? The answer is no, we don't. there's no way to get 100% of the herniation. You can get about 60, 70% of the herniation, but you're not going to get 100. No doctor gets 100. There's no such thing. It's impossible. There is no surgery that allows a surgeon to get 100% of the herniation. So what I tell people, which is true, is that you need 50% of that herniation taken out to get symptom relief. That's an average, of course. And typically with this surgery, we're going to get about 80%. So we're way beyond the 50% threshold needed. Sometimes we get lucky, we get 90%, but that's the best case scenario. There's no such thing as 100%. There's always going to be some herniation left. What we don't want is symptoms. We don't want symptoms. And we want something that lasts where the patient doesn't have symptoms. All right, so we did a little antiseptic there with some betadine. We irrigated it all out. We've never had an infection from this surgery. Spinal infections are devastating. They're horrible. It's not like having acne where you pop a zit and you're done. If you get a spine infection, you're looking at 3 months of antibiotics going in your vein. And not just a vein, they have to put a central line. They have to put a catheter called a PICC line. It goes into your heart, from your arm to your heart. And they got to change it out. It's got to be flushed with heparin every day. They get clotted up. They get garbage on the surface that can actually cause problems, like a bunch of scar tissue on the surface of it. And you got to take this toxic antibiotics, for 3 months into your body to get rid of the infections. Now I say 3 months, sometimes you get lucky, you get 8 weeks, but I've seen too many 3-monthers because there's so much antibiotic resistant bacteria these days that people need to be aware that antibiotics may not work for them. I've seen it happen so many times, not with my patients, but with other patients. We have people that come here all the time. They've had surgery elsewhere. They got infections elsewhere. Even at top universities like Harvard or Johns Hopkins or Mayo, they go there and they get an infection with their spine surgery, and then they're on those toxic antibiotics for, months. If they're lucky, it's months. Some people never get off the antibiotics. So the fact that there's a surgery that doesn't have infections, folks, that by itself is a reason to get the Duke laser disc repair. By itself. I feel like it's trapped. Shot? All right, that's good. Forget about every other benefit of this surgery. Just the fact we've not had an infection from this surgery is the reason to get it done. Even if this surgery had no other benefits over other types of surgery, except that you never get an infection, even if it didn't have as good of an outcome, it'd be worth getting. Because spinal infections are horrible things to happen. I've had them in my own patients in the past with fusions. Before we started using vancomycin antibiotic powder within the wound bed, we would get infections. About 5% of my patients, 1 in 20, would get a spinal infection. This was like 20 years ago. And then I started putting vancomycin powder in the wound bed. I read about topical vancomycin. Well, what are you doing? Hold on. Shot. So I read about this paper a long time ago, back in around 2002. There was a group that tried vancomycin powder in some type of a neurosurgical wound, and kind of didn't think much about it for a few years. I started doing my surgeries, fusions, and on my own in 2004 when I went into practice about 20 years ago. And I started getting a few infections here and there, you know. Less than most doctors, but still, any infection is bad. And then I remembered the paper on vancomycin powder. And I went back and I looked it up and read about it and decided that the right dose would be 1 gram of vancomycin. We got a cold weld. Shiza. Just pull the whole thing back a little bit. Pull everything back. Stop. Shot. Yeah, pull the whole thing back. Let's pull the whole thing back a little bit. Shot. A little more. That's good. Shot. That's perfect. Leave everything there. Let me pound this in. Let's see if I can get it to. Let's see if I can get it to move. Shot. Shot. I don't think it moved. Damn. Let's pull it back again.
Again?
Yeah. Pull everything back. So we're working on, we got a cold weld between the dilator and the tube. So we're trying some technique to separate the two a little bit more. But basically, yeah. Now I'm going to hold the outer tube still and I'm going to put the, there we go. That should have done it. All right, let's see if we can get this to work. Let me get in there, please. Shot. Uh-huh. What is that? What just flicked? Huh?
Not sure.
Let me see the dilator. Oh, sorry. You have another one? Something else?
Maybe. Do we have something to push it out later? Do you want another dilator?
Shot. 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 Fucking crap. Go ahead and irrigate that thing. All right, so we're going to try again. Last disc. We're just trying to get the tube to slide down the dilator, but some soft tissue has gotten in between. I want irrigation. Give me some irrigation back here. You can do not saline, but do the num-num. Num-num. Huh? Let's go. Num-num. Just pour it in there. No, no needle. Just num-num. Yeah. Ready?
Ready.
Yeah, go ahead. Give me a little.
Let me know.
Shot.
More? Is it?
That's good. All right, let's try this.
You want the
Mallet. You got it? Shot. Shot. It's moving the dilator again. Shot. Shot. All right, that's better. We got it this time. That worked. So all we did was, huh?
maybe you should do a little bit of that on all of them. Prevent that. I'm just thinking.
I like thinking. Thinking is good. Thinking is good. That's problem solving. So the reason why we show these videos live, well, first of all, we want you all to see what really happens in the operating room. We're not hiding anything from you. Other surgeons will never show you their surgeries live because they don't want to be sued. They don't want you to see how bad they really are. I mean, listen, the Duke Spine is we've been broadcasting live spine surgery for 10 years from our operating room. 10 years ago, we installed cameras into the ceiling, connected them to all of our devices so that you guys can watch and you can see what the surgeon sees and everybody else sees. So we want to share our experience with you so you can see there's some honesty left in medicine. Not much, but there's still a breath of fresh air where you can go and you can see spine surgery done without editing it, without hiding things, just true to form with discussions, questions, answers, and of course, when things don't go perfect like they just did, you could see how I solved the problems with my team's help. And we got a great team. I mean, just so you understand, this facility is not contracted with insurances normally, and that creates a problem for patients who want the surgery that have insurances. And we've tried to contract, but the insurance companies, they don't want to pay for your surgery, basically, is what it comes down to. So the way they avoid having to pay is by saying, oh, the facility is out of network. Well, it's out of network because they won't contract with us. We've tried. So they just don't want you getting this state-of-the-art surgery because it's expensive for them to have to pay for everybody's back surgery. And they know that people will be afraid of having fusions done. So, long story short, we can't do the surgery anywhere but this location at Duke Spine. And because of that, because they won't contract with us, because they don't want you guys getting the surgery done. They don't want to pay for it. That's really what it comes down to. But you can see, you can't just go anywhere for the surgery. You have to have the right equipment. You have to have the right personnel that's trained, experienced, to help get out of issues and problems like we just did, okay? So if I just go somewhere else where they've never done the surgery and try to do the surgery, it's going to be really bad for the patient because we're going to have challenges that come up that we cannot overcome because I don't have the right tools, I don't have the right equipment, I don't have the right medications or the right staff to help me. So having the surgery done in a very specific place that has all the right tools and equipment and personnel is very important. All right, look at the size of that tear right there. You guys can see it. And there's some inflammation going on right there. So Henry, this is actually a really good one. Right there, Henry, you want to get that?
Copy that.
So get a still right there where the laser's just out of the way. Now you can still see all the inflammatory tissue. And then get this, all of this, how the laser blasts it and gets rid of it.
You got it.
That will be another good one to add to our little video.
Also, we have another question.
Sure.
This comes from Billy54 once more on YouTube.
All right.
And they asked, my understanding is a desiccated disc has no propulsa left in the disc body. Is that true? And will your technique help? I will be sending my MRI to you. I'm from Canada.
Yeah, Billy, you're right. A desiccated disc that's completely degenerated does not have any nucleus propulsus left in the disc. And guess what? You don't need it. So all these doctors have been telling patients, oh, the nucleus is gone, you need a fusion, or you need a cage, or you need an artificial disc, or you need something to put in there, but you don't. The fact that the nucleus is not there is not the problem. If I took nucleus out of everybody's discs today, guess what would happen? There would be no back pain anymore in the world. The nucleus is the reason for the back pain. So the fact that it's all gone is actually a good thing. I know it's totally counterintuitive, but the truth is we as humans can appreciate the grand design of a human being. The human being and all life forms on Earth are amazing because the way you get to appreciate life is by understanding the processes that are required to make life happen. And one of the most important things I ever did in my life to understand the value of life was to become a biochemist. Biochemists have an understanding of natural processes that occur at different levels within the body. from a genetic level, from DNA and the DNA transcription, translation into proteins, and then the function of those proteins, enzymes, catalysts, and how proteins and lipids and carbohydrates all work together to form cells, and how small molecules are important in cellular processes to make life happen, from a cellular level to a tissue level to an organismal level. And the point I'm trying to get at is, when you really become highly educated in the human body and how it works, you learn about a science of embryology. And embryology is basically how life forms are formed from embryos, from their parents, basically contributing genetic material to the new life through sperm and through eggs, you know. And basically what happens is, when a sperm and an egg come together and they form this embryo, which then becomes a fetus as it develops within the mother's womb, there are these events that occur. Specifically, these events are called cellular proliferation and differentiation and migration. So cellular proliferation means the cell, you start with a single cell organism, an embryo, and then it multiplies into multiple cells. Each cell grows and divides, and then they start to move and migrate to different locations within the embryo, and eventually the fetus, and eventually the baby, obviously, that's born. And they differentiate. Differentiation means they take on characteristics, physical characteristics and biochemical characteristics of cells that they're going to become in an adult, basically. Whether it's the liver, the kidneys, the brain, the bones, the muscles, the skin, all those tissues are formed embryologically. The most important tissue during early embryological development is something called the notochord. And the notochord is the tissue that's needed, that its purpose is to cause other tissues to basically do their job. It differentiates other tissues into the different three primary germ layers, which are the ectoderm, the endoderm, and the mesoderm. And from, of course, the ectoderm you develop your skin. The endoderm is the lining of your gut and respiratory systems, kidneys, and then the mesoderm is everything in between. So all your organs and tissues and muscles, your heart, your actual lungs, your liver, your bones, your spine. So long story short, that notochord tissue that was so important in causing the differentiation of other tissues, other cells, into their ectoderm, endoderm, and mesoderm, that notochordal tissue becomes the nucleus pulposus. That is what the nucleus pulposus is. And I don't believe the nucleus pulposus was put in the middle of a disc to perform a structural function. I believe the nucleus pulposus was put into the middle of the disc to hide it from the rest of your body, because it is so pro-inflammatory, meaning it causes inflammation. If it ever gets exposed to blood vessels, capillaries, tissues, it causes inflammation to happen. It's one of the most inflammatory tissues in your body. It actually is the most inflammatory tissue in your body. So your body basically does not ever attack itself with inflammation normally. Okay? It doesn't attack itself with inflammation normally. It attacks foreign bodies, foreign substances, things that your body recognizes as not being part of you. It considers those things to be foreign invaders. And when it sees a foreign invader with the inflammatory system, it attacks it and tries to destroy it. It's called inflammation. It's what happens when you get a zit on your face. You get inflammation in the zit as your body tries attacking the bacteria that are there. But in the middle of your disc, you have this nucleus pulposus that's considered a foreign body. And when your inflammatory system actually sees it for the first time, when you have a herniation, that's when it attacks. And that's when people get horrible pain in their back or neck from inflammation. So, what I'm saying to you is true. After you've been born, there is no purpose for your nucleus pulposus. It is the residual notochord that sits there inside the disc, hiding from your inflammatory system, only to be revealed to your inflammatory system through a herniated disc or a bulging disc. So you don't need your nucleus. You don't want your nucleus. There are people without nucleus. They have no back pain. They have perfectly normal lives. They do all the sports and activities they want without pain. We see it all the time as doctors. There's lots of people with degenerated disc and herniated disc that have no symptoms, and we don't treat them. We leave them alone because there's no way we can make them better than what they already are, asymptomatic. So that's the truth about the nucleus. You don't need it. You don't want it.
About 5 minutes?
3 minutes. 3 minutes and we'll be done. You're welcome. Just about finished, so feel free to type up your questions. I'm going to answer them when I get done. We're just about finished here. We're at the outside of the disc at L4-5. And I've just removed all the herniation. I'm going to take a peek around the corner in just a minute. But feel free to type your questions and I'll answer them for you, okay? We've got one more surgery today. It's a patient who's having 2 discs in their lower back fixed for herniated discs. They have back pain, and that'll be the next surgery. This patient is snoozing away. He's very comfortable and happy. We'll be waking this patient up shortly. By the way, the thing on the right is the end plate. People ask me about the end plate. That is the end plate. That's the end plate of L5. Okay? Nothing wrong with the end plate. We're not messing with it. There's some fat. We don't charge extra for removing fat. And I'll be there shortly, Henry, to answer questions. So let's have the audience type up their questions. You can visit our app. We have a Duke Spine Institute app on the App Store. It's free. We don't charge for it. You can get a lot of good information on the app. I would also say that we're in the process of redoing our website to make it even better for people. More information, and to really share contemporary knowledge about back problems and neck problems. Next week, there won't be any surgeries. I'll be out of town, and I'll be back the following week. All right, we're done. I don't see any more herniation. It's looking good. The nerve root should be right in there, in that fat. Oh, there's some right there. You guys see the nerve? Right there.
Yes,
you
we
guys
do.
see it right there. That white thing right there. Just under the fat. Notice how the fat is around the nerve root, protecting it, and the nerve root is just outside our tube, okay? So it's protected. We're done. Beautiful surgery. Scope off. Great job, everyone. Little betadine. Type your questions up for me. I'll be happy to answer them for you. Great job, you guys, gals. Gals and guys and gals, everything else. All right. So, can you guys see the incision here?
Yes, we can.
I'll show it to you. I'm going to take this out, the tube. You can see the whole surgery was done through this tube. And we did one incision on the right and one on the left. Oh, yeah. So we always put some pressure on the muscle. We don't want the muscle bleeding for any reason. I'm not saying it is going to bleed, but it's always best if you just put pressure. There's no bleeding. So we probably lost, what, 1.5 cc's of blood, maybe 2 cc's. A typical back surgery, 4-level, for example, fusion, if this patient had a 4-level fusion, let me show you how big the incision would be. Let me have the dilator. If we did, instead of the DLDR, if I fixed his back with a fusion, this is what the incision would be, that long, about 11 inches, okay? And imagine the amount of pain he would have with a 11-inch incision, peeling all the muscles off the spine, taking out the bones and ligaments. By the way, we have those surgeries on our YouTube channel. Go look for a TLIF, T-L-I-F, transforaminal lumbar interbody fusion. It's on one of our playlists. If you go to our YouTube channel, play around with the playlist. It's in the top section. And you can watch. I have hundreds of those surgeries online. All right, here's the incision. See it?
Yes, we do.
All done. We're going to put some Band-Aids on and we're done. Let's go ahead and cut to a testimonial from one of our patients who had surgery here recently. Thanks, Jordan. Good morning, I'm Dr. Duke Majan at the Duke Spine Institute here in Melbourne, Florida, with one of my patients who traveled from California. He's been suffering with his lower back pain for years and found us on the internet and decided to come here and have the endoscopic Duke laser disc repair. We performed that 12 hours ago, and here you are, ready to go back to California, it looks like. How do you feel?
I feel great. It took a long time to get to you. Surgery was quick and painless. I don't remember a thing. Your staff was wonderful, but I am pain-free.
That's awesome. Yeah, and you're going to stay pain-free. We don't have you on any pain meds. We don't have you on narcotics, killing your pain. We didn't put any medicine in your back to stop your pain, so what you have is natural. And do you feel that pain anymore that you had before you came here?
No, the pain is completely gone. In fact, I quit taking my own pain pills 2 or 3 days before I got here. And I am on no pain pills at all, and I feel wonderful. When I woke up this morning, it was a different day, and I feel great.
And I feel wonderful for you for doing that. That's why we do what we do. We can cure pain, and we want everyone to know that, because nobody should have to live with pain every day. How does pain affect your life every day?
Pain is traumatic. The kind of back pain that I was suffering put me in bed. And for the last 3 months, I have been absolutely useless. Absolutely useless. And so I found you. It took me a few months to get here, and it was worth the trip.
It will be for the rest of your life.
Absolutely.
Worth the trip. Pain robs us of our dignity, doesn't it?
It does. It absolutely does.
And your parents are here, and they're very supportive. And that, to me, is so important, that you have people that understand what you're going through. I'm sure your parents have been a big support for you.
Oh, absolutely. Yeah, I was at work, a short story. I was at work last Wednesday dealing with this pain, and my back finally gave out to where I literally could not walk anymore. And I was 600 miles from home. And so I called my mother and father. They flew to San Diego and arranged the trip to get here. I called your place. I was scheduled for February 2nd, and I asked Richard on the phone if he could get me in sooner, because I was desperate. And you guys got me in a week or two sooner, got me in the 24th, which was yesterday. And so we made the arrangements, and I flew here, stayed in the hotel for a couple days, and was operated on yesterday. And yeah, it's well worth the trip. I apologize for getting emotional, but it's been a long trip to get here.
Well, we want you to get emotional, because it is an emotional thing. When you've been burdened with this pain for so long, and then suddenly it's gone, and you realize that life can be lived without that pain, you know, and that you can actually have a life without the pain.
Yeah.
So what are you going to do now that you don't have the back pain anymore?
Well, I'm going to get my life back together. I've got a new job, and they've saved it for me. My boss is wonderful, and I'm going to go back to work tomorrow, actually, if you can believe that.
Yeah.
And I'm going to start riding my bicycle again and getting healthy again.
Well, your surgery went very well. I don't know if you've watched it yet, but we were able to get in with a tiny 7mm quarter-inch incision and fix both painful discs, and they were both very painful for you. And the pain was coming from a small tear that's located in the back of your disc where your herniation came out of. And that tear was just so inflamed, and we were able to clean out the herniation that was stuck in your tear and use the laser to debride it. And that's what the Duke laser disc repair is. It's a debridement of the annular tear to eliminate back pain and leg symptoms. So we also have a cyst. We didn't treat your cyst. And do you think the cyst is causing any problems for you?
At this point, no. I don't think so, because all of my symptoms are gone. This morning when I woke up, I was a little nervous about getting out of bed. But that subsided quickly when I stood up and could stand up completely erect with no pain or bindage feeling in my back.
Yes, when I walked in and saw him this morning for the first time, the first thing your mother said was, "Look how straight he's standing." So they must have watched you suffer for a long time.
Oh yeah. Yeah, my mom's a great lady. I'm blessed to have her in my life. And then that's my stepfather, Jerry. He's a wonderful man. He and I are pilots. We fly together. We do a lot of things. And he's seen me go downhill. He knew something was wrong, you know.
How did you find out about us?
I've been seeing a chiropractor in Sacramento for 35 years. And 2 months ago, I started to really feel bad. And I would go to him. And after about a month of going to him, and going to my doctor for some pain management for these symptoms, I finally figured out that something else was wrong with me. And so I asked the chiropractor, what can we do, because what you're doing is not helping me. My doctor put me on pain meds, and they took some of the sharp pain away, but nothing was helping. And so, being kind of a mechanical engineer, I decided to look into how my back was put together. And I requested an MRI from my doctor and from my chiropractor. And so that took 3 weeks to schedule. That's a long story. And I finally got an MRI, and I looked at it myself and realized that I had a cyst of some sort and that I had some problems with my lower discs. And that's when my chiropractor told me about you. He said, get on the internet and do some research and then call these people. So I called your store. They gave me some information. I FedExed my package to you guys, and a week later you called me. And about a week or two later, I got here.
Wonderful.
So, yeah.
And here you are pain-free for the first time in many years.
Many years.
Congratulations.
Yeah. Thank you.
Is there anything you want to say to your fans out there?
There is. This is a miracle. In Sacramento, everybody that I know said, why are you going? Why are you going to Florida? Why don't you find somebody in Sacramento? And I said, well, because I was referred to Dr. Duke Majan, and I've done a bunch of research on him, and I just have a great feeling about him. Not only that, he personally called me on the telephone because I told his people that I had some questions. And that's what sealed the deal. And so it took a while to get here, but it was worth everything. And I would recommend anybody send your MRI to this guy, and if he can help you, he will. Okay? Thank you, Doc.
You're welcome, sir. It's my pleasure.
Yeah, absolutely.
All right, go enjoy the rest of your
All right,
life.
thank you.
All right, Dr. Duke Majan, I was just with you in the operating room on this patient's back surgery, and we did 4 discs. Just so you understand what I'm talking about, if this is the spine here, you know you have a front to the spine and a back to the spine. And a lot of the pictures we took today were always from the side. We did get, I think, a front back shot as well at one point. But you could see clearly that the spine has holes in it. And one of the holes off to the side, there's one on the right, one on the left, and it's got a series of holes that line up, and each of the holes happens to line up with a disc. You guys see the disc right there? So the hole is behind the disc, and what comes out of these holes is your nerves. And when the discs herniate backwards, they can actually pinch the nerves coming out of the holes. And if it's a right-sided herniation, it'll pinch the nerve on the right. If it's a left-sided herniation, it'll pinch the nerve on the left. In this patient's case, he had right and left leg problems because the nerves are being pinched on the right side at some of the discs and on the left side at the others. So what I did was I went in on one side to fix the L3-4, L4-5 disc herniation, which was his right side, and then on the left side I went and fixed the L1-2 and the L2-3. That's what he needed done. He was getting weakness in his legs, numbness in the legs. It was only going to get worse, and he had that surgery performed today. You could see from going back and watching the 4 different discs that each disc was different. And some of the discs were less degenerated, more herniated recently, and then some of them were more degenerated. For example, on the right side, the second to last disc we did was the L3-4 right side. That disc wasn't very degenerated at all. It was actually nice and healthy, but it had a tear with a lot of that material with scar tissue, and I cleaned all that out with the laser. That's going to fix that disc. The other discs, I did the same thing. They were just further along. They were more degenerated. But it doesn't matter how degenerated your disc is. The Duke laser disc repair can get rid of the pain from that disc. It can unpinch the nerve at that disc. Everything that surgeons need to do, it does. And it does it better than any other surgery available in the world, by far. All right, we have questions.
Yes, we have a question, a comment. This question comes from Angel DDS on YouTube.
Angel DDS.
Yes.
It's nice to meet you, Angel.
And their question is, once disc material removed...
It's my pet octopus. My octopus is having a good day today. You see that smile? So most people don't know about this, but I actually love the ocean. I love coral reefs and marine life. When I'm having a bad day, that's what sits on my desk right there. On a good day, like today, it's a happy octopus. Okay? All right, go ahead.
No worries. It's from Angel DDS on YouTube. They ask, once the disc material is removed, what cushions it, and what prevents it from collapsing in the future?
Yeah, great question. So Angel DDS, I assume you're a dentist. This is the disc, this whole thing, okay? We didn't take the disc out with this surgery. All we did was we took out the herniation, which was in the back corner of the disc. So even though your view, it looked big, that actually is an endoscopic view, it's really small. Just to give you a reference point, that little glass fiber that you saw coming down from the top, that's the laser fiber. That fiber is 1 millimeter from side to side. It looks huge. So in reality, the area that we're operating on is tiny. It's around maybe 2 centimeters long and maybe 7 millimeters wide. So it's a cylinder in the back corner of your disc. And the material that we're removing with the laser, it is not part of the cushion. It's already left the cushion part of your disc. It's shot out through a tear, and that's what we're removing. Now, if you're asking me, I understand that, Dr. Duke, that you're not taking any of the cushion out of the disc, but what about patients who don't have any cushion left in their disc? You don't need it. You don't need it at all, okay? The fact of the matter is not having the cushion is actually a good thing for you. It means you're not going to have a reherniation.
All right, and then last but not least, we have a comment from Billy54 on YouTube.
Uh-huh.
And they said, thank you for answering and great work. I worked in the instrument business for over 30 years and have met Dr. Roton at meetings. I am so glad I found you because all the other surgeons are pushing TLIF. Thank you.
Yeah. Well, Billy, I appreciate your comments. That's a beautiful story. Dr. Roten, incredible man. For those of you who ever had a chance to meet him, when I was recommended by Dr. Marty Weiss at USC, chairman, that I should train with Dr. Roten in Gainesville, my first response was, hell no. I mean, after all, I'm in Los Angeles, California, right? The cultural mecca of the world. Just kidding. But of course, Los Angeles think that they are the cultural mecca of the world. That's where Hollywood is. We have beautiful beaches. We have, you know, the Tournament of Roses parade, the Pasadena. We have lots of things in LA. So coming from Los Angeles, San Diego, when I was told to go to the University of Florida, what? Is there a University of Florida? I mean, where's Florida, right? I'm just, seriously, that's how I thought back then, but obviously I'm further along in life, a little bit more enlightened and educated than I was back then. But coming from California, we tend to believe that the best things in the world are in California, and USC is, of course, the top neurosurgery training program in California at the time, under the direction of Dr. Marty Weiss. So when Dr. Weiss told me, you should leave LA and go to Florida to train with Dr. Roten, I just saw like orange trees, and in the middle of orange trees there's a shack, and that's the neurosurgery department. So yeah, I'm just having some fun with you guys, but that's really what I thought. So I thought, why the hell would I ever go to Florida and leave California? California's got the best neurosurgery training. I am not going to leave here. And then Dr. Weiss explained to me why. He said, what makes the program so good, or makes any program in neurosurgery so good, and this applies to all doctor training actually, is the faculty. The faculty. So how many are Harry Potter fans? I am, but I'm not, I don't like have a wand at home. Well, maybe I do at home, but it's not mine. But the point I'm trying to make is when you watch Harry Potter, all right, the whole movie is based around Hogwarts. Hogwarts being a university, basically, for the students. Excuse me. Hello? No, sorry. I love those calls. Anyway, long story short, Hogwarts is a place of higher education, right? But for wizards. But the point is that what makes it so special is the students and the faculty and the environment. Okay, everything that goes along with it, and that's really what makes residency training programs special. Is the faculty, the environment, the students, and of course the patients. And so what Dr. Weiss was trying to explain to me, and I really had a hard time understanding it initially, was that you're going to get the very best training in the world at the University of Florida because of the faculty and the effect that the faculty had on the community. And what that means is, you see, neurosurgeons need challenging neurosurgical cases in order to learn how to treat challenging neurosurgical cases. And the way you get challenging neurosurgical cases at a university is when no other neurosurgeon in the area wants to treat them. So what happens then is all those interesting neurosurgery cases like brain tumors, aneurysms, AVMs, everything, all those breadth of types of cases, they all get referred from hours and miles away, hundreds of miles away, to the University of Florida. So the University of Florida, where I trained, actually got all kinds of interesting brain tumors and pediatric cases with little kids with all kinds of malformations of the brain and brain tumors and things. So what that does is it puts those interesting cases and patients right in our lap. And of course, when you have the best faculty in the business, they do the most advanced, newest techniques for those patients. So that was the value of UF, what Dr. Weiss understood, obviously, and I didn't. But I listened to him in the end because I realized in my humble itself that just because I didn't understand it didn't mean that it wasn't what was best for me. And it's kind of like with kids. When you have kids, you tell your kids don't play out in the middle of the street. And the kids go, why not? It looks like a great place to play, right? But you and I know the middle of the street's not a great place to play. And so as long as the kids listen, even though they don't understand why, they benefit from that advice. Well, I benefited tremendously from Dr. Weiss's advice because I went and had the best training in the world. And what made that program what it is was Dr. Roten. Dr. Roten created that program, AUF. And when Dr. Roten was chairman, it flourished and became recognized worldwide as the best neurosurgery training program back in the 90s. Okay. Unfortunately, Dr. Roten died, and when he died, the department was handed over to a different group of neurosurgeons, and they, in my opinion, did not make the program better. I'll just leave it at that, so I don't get in trouble.
And that is it.
Hope you enjoyed surgery. It went very well. I have confidence the patient will do fantastic. Enjoy your rest of your day. We'll be back in 30 minutes for our last surgery, a 2-level lumbar duple laser disc repair for a lady with herniated degenerative disc and back